Yeah, good afternoon, everyone. It's Graham Raper speaking here. I'm the General Manager for R&G Health and Safety Coaching. Hey, thanks very much for joining us on this webinar, just discussing health and safety programs for SMEs or small to medium enterprises, business enterprises. Currently, everybody's in mute mode. This just helps with background noise and so on. But if you have any questions throughout this presentation, please feel free just to type them into the questions box. Just a little bit about R&G Health and Safety Coaching. Been around and involved with the health and safety sector in its broadest context since about 2003. But since the introduction of the new Health and Safety at Work Act in 2015, November 2015, our clients that we've been working with have achieved over 1 million hours of zero harm. Now, what we mean by zero harm is it's no lost time injuries. I think we'd all agree that any industry will certainly have its fair share of minor cuts and grazes and trips, but zero harm is defined as zero lost time injury. And together with the team, about 40 years experience to bring to the table, so to speak. So what we're going to talk about, or what's up in this presentation, is what is a PCBU, the legislation and requirements that are by law required. Talk a little bit about the difference between documentation and implementation. Some examples of how it comes together and what happens when it doesn't come together. And again, what's in it for you. And the outcomes. So what is a PCBU? Well, this is an Australian term. We have adopted the Australian model of health and safety. You'll be aware that now that the change to the Health and Safety Act was driven by the events of Pike River. And out of that, the New Zealand government at the time looked around and found that the Australian system, particularly Victoria, was best suited for the New Zealand context of health and safety. The key difference between the old Act and the new Act is that the new Act is driven on risk management or behaviour management. So you'll see throughout the Act, if you have an opportunity to look through it, there's lots of references to Australia. So this is the term, a person conducting a business or undertaking. And very importantly, compared to the old Act, it's either alone or with others. Previously, if you're a sole trader, the Health and Safety Act didn't apply. The new Act does. So if there's any money or services requested or offered, then a PCBU relationship exists. Therefore, the PCBU is required to have in health and safety implemented processes. We'll talk more about implementation and processes as we move on. So the legislation, and it's called the Health and Safety at Work Act 2015. It was passed in law in November of 2015 and was enacted in April of 2016. So they talk about various people involved. Now the officer is the person who holds the overall responsibility for effective health and safety processes. So that's the person at the top of the tree, so to speak. It's often the director of the business or directors. People of influence or person of influence. Now, that can get a little bit more complicated, but essentially is that within a business, if there is anybody that has a direct involvement in health and safety or can direct health and safety requirements, they are a person of influence. So in some cases that might be a senior manager or even a shareholder, or the shareholders who decide what needs to occur. So a person of influence is part of that process. Everybody has a duty of care or a duty to care. What that means is that from the director of the company right through to any of the workers, and it may even be a part-time cleaner or any of those roles that may not seem to be part of it, are absolutely part of the whole process. Everybody has a duty of care. And that's where we come to the hazards and risks. The old Act talked about, and we used to have to measure hazards. So a good example is a quad bike is defined as a hazard. But quad bikes actually don't kill people, despite all the hazards identification and paperwork that's done around them. What causes death on quad bikes is the individual that operates them. That's the risk. The risk is the individual, the person. They create the risk. They're responsible for the risk. They're required to manage the risk. So in a paddock, we had a great big rock and a quad bike sitting in a paddock. They will both hurt you if you run into them, if you're silly enough to run into them. But on their own, they pose no risk. You climb to the top of the rock, you create a risk. You ride a quad bike inappropriately, it creates a risk. So understanding that is really important. So wherever I am is where the risk is with any staff. Wherever they are is where the risk is. If they're out and about working with clients, that is where their risk is. We want people to manage their risk and take appropriate action, not fill out a million forms. We know that doesn't work. So a health and safety process and a system really has two parts. We have the documentation, and that's what you say you will do. And it outlines all the various parts about providing PPE equipment, drug and alcohol policies, and so on. Most of those policies are legislatively required or are requirements in different laws, whether they be construction or others. The Health and Safety Act is an overarching document. A good example of that is the Smoke-Free Act. Under the Health and Safety Act, you're required to provide an environment that is safe. The Smoke-Free Act requires workplaces to be free from secondhand smoke. So that's where the two come together. So and documentation, you'll see in some of our examples, is only part of it. If you want a manual and it's all printed off and looking pretty and put it on the shelf to gather dust, our suggestion is you buy a vacuum cleaner. It'll do a better job of getting the dust, but it serves no purpose. Therefore, having any health and safety processes to prevent harm has no purpose. So then comes the implementation. This is how you do what you say you were going to do, or how you monitor what you say you're going to do. And that's the most important part of any health and safety process, is ensuring everybody understands what they need to be doing and that they're actually doing that. So we'll take the quad bike, for example. The farmer says, here's your quad bike, here's a documentation that says you're going to ride it properly, and then walks away and allows the person to ride the quad bike in any manner they wish. If they see them riding inappropriate and doing nothing, they are culpable, and you'll see by some of the acts. So having a paperwork is one, ensuring people do what they say they're going to do is the other. Again, it's not about paperwork. So a couple of examples, very recent example, a tractor driver. We'll send this out to you so you can check out these links for yourself. 200-hour working week up in the Waikato. In the prosecution from WorkSafe, the company had recently undertaken a health and safety review and produced a whole lot of documents. What was very clear, they did nothing with them. And nobody actually, again, they just became a dust collecting agent. Toll, again, a man dies after a forklift accident. They had all sorts of stuff and documentation and certain barriers they put in place, but it was robotic tick boxing exercise. And because of that, nobody took any notice of it in real terms. They didn't monitor their risk and a person died. They were prosecuted for not ensuring that people were doing what they needed to be doing. And then we go right down to a hand injury in a Queenstown bakery. Some of the discussion around there, well, they shouldn't have put their hand where it shouldn't have been. That's fair to say in many cases, but it was preventable and the fines were substantial. Now, just a note on fines, you cannot get insurance for fines or reparation. Well, you can get insurance for the cost of the court, but you cannot get insurance for fines and reparation. So what we do to work with you to ensure that at the end of the day, people go home unharmed. That's the purpose of doing what we do. So to do that, we've got a nationwide and well-recognised consistent implementation program. So it doesn't matter where you are in the country, implementation strategies are the same as they should be. We provide all the documentation and guidance on implementation. The documentations are provided by an electronic portal, so they're always up to date. It's the latest information. You can access it anywhere at any time, and knowing that what you're reading is the latest information that's available. So any legislative changes are done immediately. The most recent ones are around management of hazardous goods, in the building industry and property management industry around asbestos management, and so on. So as they come to notice, we immediately work to find a solution that provides the appropriate solutions within your system. All the programs are developed on a proportional process. Now, WorkSafe, it's a new word by WorkSafe, or relatively new word, is that they've been very clear that a health and safety system needs to be proportional to the risk. So we work with that, so all the system has a basis, and then from on there we're able to add or subtract to meet the proportionality of what's required. So we develop to meet your risk profile. So proportionality, just a couple of examples there. We've got an accountant. Processes and implementation strategies will certainly be different from engineering, which will be different from farming, which will be different from forestry. But the fundamentals are all the same. The risks are greater. Now, we know that forestry is one of the highest injury death rate industries in New Zealand, and engineering is up there as well, but they have, an engineer often has numerous machinery and a lot of staff working in and around each other. So the risk is different to a farmer that's working on their own, for example. So the proportionality is working through which bits fit which industry, so that they're focused on managing their risk. So what will hurt me and how do I manage and prevent from being hurt? And age-old question for a system is, how much is this going to cost me? So $75 per month plus GST to 1 to 5 employees, and 95 plus GST for 6 to 9 and 110. So this is based on your base package. Everything is provided for you that should enable you at that cost to maintain an effective process that ensures people go home unharmed at the end of the day. We provide some consultation if you've got staff, induction processes, so that all the staff are aware of what it is that they need to be doing. They get, for want of a better word, an induction book or a no excuse booklet. There's no excuse for them not to know what their requirements are, what their role is they need to play. You can access us at any time, phone or email for advice and so on, and we'll just keep you updated. If the only thing that changes is if you require something specific, for example, an unfortunate case of an incident and you wanted to investigate it. But essentially, that's your base That's all it should cost you to work with and develop your processes and systems to ensure not only are you compliant with the Health and Safety at Work Act, that in the event, we hope it never happens, of something going wrong, you'll have the evidence required to demonstrate not only that you have the documentation, but you took the time and the energy and the effort to ensure people understood what they required in an implementation strategy. The really good part about the Health and Safety at Work Act, it talks about all reasonably practical steps. So you're not expected to do unreasonable things. It's asking you to measure the risk and manage any risk that appears. So here's just information on the next steps following this presentation. The team here will send out an email outlining the next steps to follow. So there's a bit more information and the process about engaging our services. But certainly feel free to give us a call on the numbers there, 03 99 1403, or email at support@rghs. More than happy to answer any questions and queries you may have and helping to ensure at the end of the day that people go home unharmed from their workplace or from wherever they may be working. We again really appreciate the time you've taken to attend this webinar. I hope you found it useful. And again, feel free to contact any of the team if you have any further questions. Thanks again.